Hey everybody, it's Skip Ballard, Touching Hearts at Home. Thank you for joining me. Today I have Amanda Gustafson, the Chief Executive Officer from Adoray Home Health and Hospice with me. Welcome, Amanda.
Well, thank you, Skip. Thanks for having me here today.
It's great having you, and I appreciate your other video you did with us on the Hospice 101, Basics of Hospice. That was an amazing video. I encourage everybody, check it out if you want some more information about the hospice benefit and program. Adoray has a wonderful hospice program, and I encourage you to check it out. So Amanda, today I just want to talk about people that are, in that healthcare journey, and they have a need for like skilled care, but sometimes they don't know where they fall in or where they qualify. So there's definitely a need there. They need some sort of skilled oversight, but they don't know what they qualify for or what program would be best. Adoray you have the full continuum. You have the home health, you have palliative care, and you have hospice. So just want to just take a few minutes and just kind of go over, just summarize, what each benefit or program is. And obviously, if people want more information, we'll have your information later in the video to contact. But just kind of give a 101 basics on those three levels of care.
Sure. Well, like you said, Skip, Adoray provides home health, palliative care, and hospice. And our goal is to be able to meet patients' needs throughout their continuum of care.
Yep.
And our first program is home health. And home health is really focused on rehabilitation. So we provide skilled home care that is performed by a RN case manager.
Mm-hmm.
And the goal is to help that patient back to where they were before they needed home care. So if they have some sort of serious illness or they had a surgery, our nurses will come in and help them rehabilitate. We also have a physical therapist, occupational therapist, and speech therapists that can assist patients as well under the home care.
Okay.
As well.
Yeah. Okay.
New this year, we started our palliative care program. And that palliative care program was developed as a bridge between home care and hospice. Since COVID-19, we have seen our patients much more chronically ill than they were prior to COVID-19. And so many of our home care patients have more chronic conditions than they did. And when they're discharged from home care, we wanted to have a bridge that would allow them the option to stay on our services and be able to continue to receive care under our palliative care program.
Okay.
So palliative care, what that is we all of the care is provided by a palliative care nurse practitioner.
Okay.
And that nurse practitioner will come right into the home on a regular basis, and then also follow up with phone calls as needed to help care for that patient. If needed, additional services that we provide are social work services, and we can provide spiritual care under the palliative care program as well.
Wow. Okay.
So the palliative care program really focuses on the physical benefits, but also psychosocial benefits as well.
Right. Okay.
Many patients that we see, especially when they're referred to hospice, may not be either physically or spiritually ready. So palliative care is a really nice option to help prepare them to move into hospice when they're ready, or perhaps they don't meet the qualifications just yet, but they still need to have that in-home care. And that's why we started our palliative care program.
Do you find there's a lot of more acceptance from people that aren't, I don't want to go to hospice yet. I don't want to die. I want to, and then, but they're clinically eligible, with their needs, but it's like, that's such more comfort for them. I know when I've talked to people over the phone, and, we're the non-medical side of it, but, when I say, they have home health and, well, we don't qualify, therapy is not going to do anything, you know, whatever. And but then there's the hospice piece, but they're like, oh, that's too far over, you know. So like that in between part, it's just so great to have that option to say, well, they have this palliative care option too, like what you said, it's that bridge, you know, and I bet you see that a
Absolutely.
lot where people are like more accepting to get into the, you know, the continuum with that.
Absolutely. And the team that they have on the palliative care program also crosses over them to them on hospice as
Oh,
well.
wow.
So
That's
they're
amazing.
trained end of life professionals that can
Yeah.
have those conversations with the patient and family to
Yeah.
prepare them to move to hospice when it's
Yeah.
time.
Yeah. And we talked about this on a different video, but just, you know, for people watching this video, is there, you know, once they do transition to hospice, then what changes with that, or what does that look like with the hospice program?
Yeah. So with palliative care, the visits are done by a nurse
Mhm.
practitioner, usually monthly, and as needed, we'll bring in social work and spiritual care.
Okay.
When they move into hospice, they have access to so many more benefits.
Right.
You know, they have access to our registered nurses that would determine frequencies of visits depending on the patient needs,
Hmm.
normally 1 to 2 times per week. They would have access to a social worker, spiritual care, they would also, have volunteer help if needed to provide companionship
Yeah.
or light housekeeping duties.
Wow.
And then, of course, we have several benefits that are above and beyond that include, um, you know, uh, aftercare, our Dream Big program, and our new end of life doula program. On top of
Wow.
that, hospice, it covers all of their medications. In palliative care, their medications would not be covered. And
Right.
then any type of medical equipment. And another thing is after a patient passes, we also provide 13 months of bereavement support for that
Oh, wow.
family.
Okay. Do you have, I know in the past I've seen situations where if somebody's on your home health care program and they're getting physical therapy, they're at the point where they qualify for hospice, or they're, you know, they're getting PTOT and they qualify, but it's like they're not progressing anymore under the, you know, the Medicare guidelines. Do you have an option where if it's not aggressive or it's just, you know, right, is it palliative in nature? Can they still kind of, as they transition onto the hospice, can they still complete and get some of that other services? If it's not, if it's kind of a limited basis or just not full.
Yeah, so as long as they qualify for home care, they can stay on our home care and be on palliative care services at the same time.
Oh, wow, that's great. So they can still get that benefit, you know, because people, and I've heard families say, ah, mom's just, she really enjoys that therapy, you know, getting that, what, however limited it is, but to know that they can kind of start focusing on that, like you said, that comfort and that bridge, but still kind of have to keep that motivation going and that those goals. So that's great that you can still do that.
Yeah.
So it's great that you have all those levels of services and really to meet people where they're at in that journey. So if people want to just call, I think sometimes people think that, well, I don't want to actually start, or I don't want, it's the pressure of, you know, I'm signing up. If I call, I'll make a referral, then it's over. I'm signing up. But is it easy for people just, you know, to make that call and just talk to somebody or have that, you know, consultation or just an easy conversation about this to figure out where they fit in?
Absolutely. When a patient or family member calls, we'll certainly talk to them about options, but a lot of times we like to go into their home and provide them with a consultation to make sure they understand all of the options available to them and
Right.
provide resources as well.
Well, that's great. So with those consultations and that information, so if somebody just wants to start the process, how would they contact Adoray?
Sure. You can contact Adoray by visiting our website at adoray.org or by calling us at 715-629-1914.
That's great. And we'll have that information on the screen too. And I encourage everybody as well, check out the other video that I did with Amanda, Hospice 101 and the basics of hospice. It's a great video. And Amanda, I greatly appreciate your time and all that you do at Adoray. I appreciate just knowing you and the relationship that we both serve in this community. Thank you so much for your time today.
Well, thank you. It was a pleasure and an honor to be here.
Have a nice day.
All right.